It's us. This is the round table. It's a triangular table, but it will work. And I like doing this. We're gonna do these more often. And
Fun.
Kaya was very motivated, and Dr. Angelica was front and center, and everybody else got better things to do, I guess. But that's okay. We got more than enough brains to cover these cases. There's somewhat hypothetical. I am recording just as a courtesy, so no nose picking or anything, no cursing. If you can hold off.
Try my best.
Uh, and well, we'll jump in, and I'll just describe briefly. I had already shared some hypothetical cases with the team, and feel free to jump in to just have an avalanche of ideas. It could even just be offshoots of what we're discussing. And just so to highlight what we would do, what comes to mind, things that you've seen before, and how we can help people that have similar concerns. So the first case is a 55-year-old male, history of low back pain, chronically bloated. His BMI is 29, high stress, and now is complaining of irregular stools and some frequency of urination, like an itchy rash under his arms. And then his concerns, his goals rather, is that he'd like to lose a little weight, and he knows he needs to eat better and just overall improve his symptoms. So, what's wrong with him?
I mean, it sounds like maybe type 2 diabetes, maybe the beginning stages of it.
Mhm.
I mean, it sounds like, there's the frequent urination. I wonder if there's also frequent thirst. And then the low back pain, I'm wondering, is that just like a postural issue or is it actually your kidneys? Are we looking at that part of the back? And
That
is that related to the urination?
so I am pulling from like a real life case, and
Mhm.
without giving away too many things, I like what there was pre-existing low back pain and mid back pain, but then there was an episode of like a UTI, which was
Mhm.
very uncharacteristic. And in this person's case, their like HbA1c, their blood sugar, and like fasting glucose was normal. So maybe not type 2 diabetes, but certainly a dysglycemia.
Mhm.
Yeah.
So, and I mean, if Justin, our acupuncturist, was here, he'd say definitely a kidney yin deficiency, a kidney deficiency of some kind that would need tonifying of that organ, and maybe changes in diet to kind of increase the nourishment of the organ, because he is showing signs of kidney weakness with low back pain and frequency, right?
Mhm.
Yeah, when you mention frequency of urination, immediately the thought for me is to your kidneys, and then you say high stress, and just recognizing that within your body that's going to be very cyclic, high stress and your kidneys being implicated. When I saw low back pain, um, and the high stress, my I also saw the correlation there just being with like exacerbation of symptoms, and your response to pain, especially if there's a history pre-existing or if it was like occupation related or activities of daily living related, and then just being in a high stress point in time in life, did it just exacerbate those symptoms that way, either like on a nervous side or somatosensory, like his perception of it could be heightened in a high stress situation as well. So kind of, um,
Yeah, I would say in particular in this case, I think that is very much happening. Like maybe a hypersensitivity, like what would be maybe one or two of symptoms wouldn't bother him, but now it's like a multiple thing where he's like what's bothering me today? It's here, it's here. It seems like it's wandering, and it's just maybe his attention to this inflammation, or this maybe yeah, just a structural thing that's off for him. He's just finding everything is making everything worse.
yeah.
What would you do in terms of physical activity or exercise? Because he's
Yeah,
got
when
no time. I mean,
no time.
yeah, but I mean, obviously we can make time.
Yeah, that's always hard. Um, we all have just a really short 24 hours in the day, so it gets really tricky to find time for the physical activity. Um, I love those guidelines. That's like 150 minutes of moderate to vigorous aerobic activity. That's something that with a lot of my older adult clients that will work up to,
Mm,
whether it's, starting with 3 weeks of, okay, we're targeting 60 minutes. So that's 3 20-minute walks per week, and then building up to that level of 150 minutes of moderate to vigorous intensity, or building up to that level. Mostly because I find when people are able to actually adhere to it and they start to feel that level of confidence building, then they actually get really interested in it and they want to do it. So they either want to do more, or more frequently. They sort of build that drive within themselves. So definitely starting there. And when you mentioned like high stress, getting that aerobic health in check and just is really important.
mhm.
So that would be the start.
Um, how realistic is that we would get his BMI down?
I would say I'm referring to naturopath. Definitely going to take a look at their diet.
His diet's not bad.
It's not bad. Is it consistent though?
It's
That's
consistently not bad.
okay. I
Like
mean,
he's dropped maybe 20 pounds
okay.
in the last 6 months, so it's not bad. Um, his digestion is, so we did, in this person's case, we did a like a stool analysis, and it does show, like, in a very simplistic way, like a type of SIBO, like a bacterial overgrowth in the small intestine. So definitely in need of cleaning up the gut. And I'm not sure if it was, there must have been something in his diet prior that was feeding into like a dysbiosis, because right now it's pretty clean. So
Mhm.
he's on some supplements to help regulate that. And I mean, his bowel habits are improving, the bloating is less. Um,
Does that sort of like overgrowth of bacteria, does that typically clear up with like regular motility and improving like peristalsis through the
It will
digestion?
help some of it. Sometimes with these irregular stools, like there might be constipation or diarrhea, and that tends to get better.
Yeah,
Um, Activity and cleaning up the diet on a basic level will reduce the overall symptom, but sometimes they do need kind of like a clearing out formulation.
yeah.
Um, Short of anything like an antibiotic, like if someone had like H. pylori,
Mhm.
usually, if it's pretty significant, they'll do their antibiotics, and then we'll go in and like repair the damage that's there. With SIBO, sometimes it's trickier. Uh, in rare cases, do you really need an antibiotic? It's not like you need a strong one for it to help, or just like more of a longer term grind with like a gut formulation that kills off bacteria, heals the gut, change your diet, improve your exercise. So, I mean, we do see a lot of like SIBO and body mass issues and pre-diabetes. They kind of feed off each other. So he is on the cusp, and I think he's a good candidate to reverse a lot of this, because he is very motivated to feel better. But I do
Right.
think the stress response is high. So it'll kind of add, sometimes make things seem like a bigger mountain than it necessarily needs to be for him. But these are good. I mean, what would be a good like, just to kind of round out, what would be a good exercise for someone that just like, I don't have time?
Um, a good place to start, like you want 2 days a week of resistance training. You can start with body weight training. Depending on their assessment, I would take a look at like a movement screen. How are they functioning? If they have really great range of motion through most of their joints and they're able to, bend over, squat, um, perform activities of daily life at 55, they're a fairly active person. You would want to make sure all of those boxes are being checked, and then even just start with body weight training, just get them up and moving. If it's a case where, they have low back pain, okay, well, how are they using their core? Some of those things start to change. Um, Given age, or if they're losing mobility in their knees, not able to bend over any more, squat down at the knees, then are they bending through their spine a lot, creating back pain that way through a strain? So those would be some things to look at, and then just strengthening like your hamstrings and your quads so that you're able to lower yourself down and back up, keeping your core nicely engaged, improving range of motion, sort of all over the place. So yeah, body weight, maybe
So a
some
lot of
squat.
functional movements, and you don't need to really be like lifting super heavy weight. Just
No, definitely not. I would say not at this point either. If this person, if someone was experiencing like a really high level of stress in their body, you probably want to ease them in and help them to re-regulate first
yeah.
before exacerbating the issue with like onset of an extreme exercise program that's probably just going to put their body over the edge, like physiologically.
Dr. Angelica, is there any either supplements or further tests that you would be curious for this guy?
To be honest, I was curious about the rash under his armpits because the first thing I thought was, okay, if this is like, if it is something to do with diabetes or glycemic index, like, is it candida or is it just from friction and sweat from like being overweight? And that's why I was curious, even in the stool test, if there was, I mean, because like their stool test was done. I
Yeah.
wonder if there was candida or if it was just certain strains maybe that are related to histamine release.
Yeah,
Um,
it wasn't really specific for candida. I mean, it is pointing more towards like a SIBO, like a overgrowth, a yeast overgrowth of some kind, but and also with some dysglycemia. So
mhm.
I think it's one of those things that I mean in the same category of like skin tags.
Okay, yeah. I mean, berberine's honestly the first thing that comes to mind,
Yeah.
just because it is antimicrobial and it works on the dysglycemia.
Hmm.
And then there's a lot of different like blends that have berberine, but then also have like allicin and some other herbs that are antimicrobial.
Well, that's good.
Yeah. I
Okay.
mean, hopefully that would clear up the bloating and some of the other
Hmm.
things along with it.
Yeah. I think that's going to be in his future plan now. Let's leave him alone. I've got another case here. 30-year-old female with a history of irregular periods. She's had some weight gain of the last year or two. BMI is at 26. Her diet is mostly vegetarian, and her main concern is that she would like to start a family, but's concerned with her history of irregular periods that it might be an issue because she's been trying for 6 months and has not conceived.
Hmm. Well, I feel like the first thing is the irregular periods. Like we need to do some testing and find out again, like what does irregular periods mean to them? Like, is it just a shorter period? Are you skipping multiple periods? Was it just a burst of time and then now it's okay? Um,
Let's assume all of that. Let's assume that sometimes it'll be like twice in a month and then she'll miss a month.
hmm,
Irregularly irregular.
irregularly irregular. Um, I mean,
Well,
there's a
what test would you do?
well, LH, FSH, probably look at
Mhm.
estradiol, DHEAS. I would look at because she's mostly vegetarian, also like, are you iron deficient? Like, is something going on there? Even worth maybe looking into the thyroid, given the fact that there's the weight gain.
Mhm.
And periods can be off too.
Yeah, so
Depending-
I think in this person's case, the move towards a higher vegetarian intake often leads to a little bit more carbs, and more carbs equals sometimes more body fat.
Mm,
And then that starts messing with, and then like, I mean, this is a possibly PCOS case.
yeah, might be. I mean, I wonder if there's other signs of the androgen excess. I mean, there's some weight gain, but yeah, I'd be curious if there's anything else on physical examination that would come up.
Do you find that PCOS often shows up a little bit earlier? Like, because she's 30.
Um, Honestly, it's a mix because some people I find have been on birth control since they like were 15 and then they get off of it when they want to have kids at 30 and then
And masked it.
yeah, and they're almost like, okay, what's my norm now? Is this my norm? Is it from the drug? Has this always been the case and we've just been like treating it with birth control?
Hmm. Yeah. That makes sense. Um, oops. Shush.
Few questions.
Yeah.
Pardon me?
PCOS syndrome, polycystic ovarian syndrome. So like group of symptoms
Mhm.
is what we're kind of my understanding.
Yeah.
Is it Like to me, that the thought that it might develop later on in life, well, later on in life, 30, doesn't seem that far off, because couldn't it be like secondary to other lifestyle factor changes or just like regular aging or anything?
Yeah.
I
I
think sorry, I don't want to jump in, but I
yeah.
think maybe there's a predisposition and then some changes in lifestyle has maybe like brought that to the forefront.
Okay.
Mhm. I
Okay.
had one patient who was her doctor like told her that she had PCOS during COVID and then said that it partially was because of the stress and everything going on and her like the change of lifestyle. And then after COVID, her labs completely changed and he said you no
Wow.
longer have PCOS. So obviously not my judgment, but it's just
Sure.
interesting to think that maybe there are some external things that are making it come on at certain times.
One of the things I also kind of was hoping to flesh out, and I think it's a little controversial, is the like the emotional side of this because it's something that I've seen in my practice where after 6 months of trying, the some of the alarm bells are going off for couples that they're like, "There's something's wrong. Like maybe we need to go fertility support and like getting ourselves assessed. And is there an issue? And what's our next step? What's our alternative plans?" Um,
Mm.
any thoughts on if 6 months is too soon to panic?
That was my second question, was
Yeah.
if 6 months is a long time or not. I don't see in kinesiology, I don't see very many people for infertility or preparing to get pregnant. So I'm a little bit naive, I guess, on that timeline. Um,
There is guidelines that I would have to look up because I don't remember, but I believe if you're under a certain age, it's 6 months. Then I think if you're over a certain age, like I think it's between a year and 6 months where they say you might want to consider seeing a
Okay.
fertility doctor.
Yeah.
And then obviously assessing like the quality of your actual eggs. Is it a problem with like seeing if it's actually a problem like genetically, like with the eggs that you do have,
Mhm.
mhm.
or if it's something else going on that's affecting you from getting pregnant.
We do get a lot of inquiries of, I mean, women in a similar situation where they're like, they may not have had like the 6 months of like like concern, but they're anticipating like, listen, I'm a little overweight. My periods have been an issue in the past. I'd like to get like properly assessed and like speak to a naturopath. I'd like to lose a little bit of weight. I'd like to train. I'd like to get my BMI down because I've heard that it could be an obstacle. So I think it's wise when there's like a healthy amount of like anticipation or like a premeditated like we're looking at this. And I've had couples come in where like the husband is like, well, I'm a little overweight, I smoke, I need to like improve my health because I don't want it to be like affecting my sperm count or my quality or anything like that. And likewise for and similarly for the woman, where if there's anything that's not like falling in the typical norm, they'd like to know.
Mhm.
So, I mean, in this case, in the back of my mind, I think that it was slightly premature, but at the same time, there is a little bit of a few areas of concern that's like maybe you do need to make sure that you're having regular periods before you have like a healthier, you know, um, chance of conceiving in the typical manner.
Right.
Mhm.
So that's something that I want to bring up. And then the last case, it's an 18-year-old female, and she's got poor eating habits. She skips meals, likes her coffee, her drive-through. Her BMI is 19. She likes going to the gym, but her diet isn't really like consistent with that, where it's a little bit all over the place. Concerned with some severe constipation where she may go to the washroom once or twice a week. And her main concern right now is noticing an increase in acne on her face and shoulders and a little bit of coarse hair development. And her goals is that she wants to lose some weight because the summer is around the corner.
I mean, honestly, this is bringing me back to the PCOS a little bit with the coarse hair and the acne.
Mm.
But also, I mean, BMI 19, still a little under weight, like, right? Like 20 is where you should kind of, 20 to 25 is normal. And I'm assuming that's related to the poor eating habits, the skipping meals, and kind of being all over the
What
place.
do you
Like,
call that?
which part?
the the underweight, but
Oh, that like the hypothalamic amenorrhea, I think,
yeah, well, I mean, is that another word for skinny fat?
or like well, like an orthorexia kind of thing. Like, oh, I don't know if she's overly into health fads and stuff like that, or just
These are
likes.
all things that come to mind, right? These are all things like we don't know at first, but like we do have to kind of like assess and maybe pay attention. Like maybe she's not aware of it because of her age. Maybe she's, I don't say immature, but maybe unaware of some of the things, the little traps to fall into. That's what I think the idea of like saying like, well, the summer's here. I gotta, get my six pack, or I gotta like lose weight. It's whatever. These are real concerns that people come in with, and sometimes you do have to be like, you're aware that you're slightly underweight, and then they'll like kind of like pinch, and they're like, well, if I was underweight, then I wouldn't have this. And so how do you address that like tactfully and respectfully, but also like in an educational way?
Hmm.
Um, Given the age, I think age is a big factor on that one. There's obviously a lot to learn, but it's a very impressionable age, so you do want to be really careful about how you introduce topics of body composition, diet, and things like that, because you don't want to create any like obsessive behaviors. I mean, the disordered eating is kind of already in place, but it doesn't have to progress beyond there, I think, to like a point where it's clinical in nature. But explaining like on my end of things, you like going to the gym, okay, well, what are you doing for your body when you're going to the gym? How are you promoting recovery? How are you are you what are your goals in the gym? Do you want to build muscle? If you want to build muscle, you're going to have to feed the tissues. Like they need something to work with to build. So um, maybe not the best point in time to be in like a calorie deficit. Taking a look at basal metabolic rate, if you have the opportunity, could be great, just to get an idea of what this person should be eating.
Yeah, I like the in body, especially
Yeah,
at this age. Maybe not younger, but I
yeah,
feel like at 18 and older, having a realistic understanding of what your body composition is, your metabolic rate, your body fat, and where your muscle mass is. I think it's fair to have like at least an initial assessment and maybe something every couple of months just to track how things are changing, and using that initial information to sculpt a healthier diet, or to educate in terms of like you need to have at least 1,500 calories based on your BMR. You should not be having less because you're not going to be metabolically active, and then
yeah.
you're
I think that's the important part, is shaping it around what the needs are.
Mhm.
Um, I almost wouldn't, I think I wouldn't check in as regularly. Again, just worrying about that, like a kind of obsessive tendency.
Yeah, if they were coming in every couple of weeks, like I want to know my body fat today, and I'm like,
I
it's
have,
that's not the
I,
point.
yeah, I have clients that still weigh themselves every morning. They're like, well, it's a difference of 0.4 today. And I'm like, okay, doesn't really matter, but sure. Like, to, like, it's big picture here.
Yeah.
But I would say those measures are really important for understanding what you're starting with and where you're trying to get to, but then also what the needs are in between and how to actually get there. Otherwise, you're just kind of like spinning on a wheel. You might not be working towards what you think you're working towards, and I think that can be really disappointing. When I see this like little bit of eating, likes to go to the gym, mention like the skinny fat, whatever, I sort of go back to that thought of, okay, is your body really stressed out, trying to make all these changes, and you're not really giving it the support it needs, whether that's through your diet or regular sleep, or maybe you have too much caffeine intake, like things like that, take your body out of that really sympathetic driven space and give yourself some time to recover. And like when I see acne and things like that, like I know that when I'm stressed out, that's the first thing that happens. So I think, that would be something to look at. And that's another way that I like to keep track with my clients, not even just the objective measures, but subjectively. So how are they feeling? If they can give me sometimes, depending on like where they're at mentally, if it's too much for them to constantly look at reports of what their body composition looks like, then sometimes, yeah, it's just journaling and them letting me know, like after I worked out that day, I felt fine and I was able to continue taking the stairs during my commute. I didn't resort to the escalator, the elevator, things like that at work. I, still did XYZ, still walk the dog. But if they're finding that it's been too much and they're too tired to carry on with their other activities in life, then the exercise regime that we're working with isn't complementing their life. It's kind of taking away from it. So in a kin space, that's sort of how I would assess where I'm at, like continuously throughout their program, and then reevaluate and rework it depending on their goals and if we're still progressing towards them.
Great. Dr. Angelica, you are our skin and acne superstar. What do you see? Like, what comes to mind? Yeah, Kaya is bang on with a lot of these things, but even like in terms of symptom relief, what would be coming to mind?
For the acne specifically, I mean, the acne and the hair, she is 18. I mean, puberty is kind of far over with, but the body's still changing in a lot of ways. So I wonder if this was like always the concern or if this is just coming up now. And I think a lot of it probably has to do with, I mean, the body needs protein and all these building blocks in order to make the hormones like the testosterone, like the estrogen. And I think that it's easy to say, like, okay, yeah, this is a good face mask or this is a good wash with benzoyl peroxide, but we're not getting to the root of what's going on. Like, she needs to be eating, she needs to completely probably change her diet, and not in a way where we're doing an limb diet, but like mindfully eating, like thinking about, okay, I'm gonna sit down, I'm not gonna watch Netflix while I have my meal. I'm gonna chew, I'm gonna say, like, do I actually feel full, or do I just not want to eat more because I'm worried I'm gonna gain weight or something like that? And then even logging, like you're talking about, Kai, about like journaling and such. Like, how do you feel at the end of a meal? Like, do you feel guilty? Do you feel okay? Like, do certain foods trigger you? And I think it's like a bit by bit kind of process. I know people, I've heard of like naturopaths using like zinc and things for people to actually like gain weight. I guess it can stimulate appetite and things like that.
Hmm.
I've never done it personally, but I'd also be very careful doing that in someone who wants to lose weight and probably has a lot of emotions tied into their physical appearance.
Mm-hmm.
And that alone is probably a big conversation. Like, how do you see yourself when you look in the mirror? What do you value in yourself outside of your physical appearance? Like, do you define yourself as a confident person, and why or why not? Like, it's a difficult conversation, but I feel like if you're not addressing that, you're missing a big part of the person and like who you're working with.
Good.
Yeah.
It's all true. And it's a hard age because they're young adults, and sometimes if I'm talking to a 18-year-old female, um, there is a little bit of a generational thing where maybe they're like, who is this old man? He doesn't understand what I'm doing. And I'm like, well, I may not have ever been an 18-year-old girl, but I borrow from my experiences, and just as you're outlining, there's a bigger picture outside of the symptoms, and you have to be, cautious with, you don't want to scare someone off, you don't want to like label them, you don't want them to feel judged, or like you're painting them with a one broad stroke, but at the same time their habits are kind of pointing in a direction of like quick, easy, direct to like just what I want right now. And we do see that a lot more with each generation. I don't know if it's in comparison to how we walked in the snow to school every day versus how it's so easy for everyone. And so I try to be mindful of that. I try to like bring it back to like, okay, what do you want? What are you aiming for? And is it in health? Is it in the interest of your best health, or is it out of like what are you using your comparison? Is it people you see on Instagram? Is it a friend of yours that maybe has just the genetics that are different than you? Or is there some tangible things that we can change in your lifestyle? And as long as you understand where I'm coming from, then I just don't seem like you know a dinosaur
Mhm.
ruining your fun.
Yeah.
That last point that you made, I'll just add, I would say that's a big part of the benefits of using something like an in-body analysis to understand your body composition. Because a lot of people come in saying, you know, I want to lose weight, I want to look toned or whatever else, and then getting them to understand like losing weight and just having very low body fat or very little muscle mass and being able to see your skeleton is actually not how you want to look. You actually typically enjoy the look of people that have a lot of muscle mass, and that's that toned look. And that takes, like we mentioned before, a lot of building and a lot of eating and a bit of resistance training. So,
Hmm.
getting people to sort of understand what that actually is in terms of
Yeah.
their goals, because this person could very well just be running on the treadmill for 6 hours a week or
Yeah.
something else, or hit 5 days in a row. Who knows, right?
Yeah, I find a lot of people are like leaning towards extreme cardio, or like I'm burning so many calories and then not building muscle, not fueling their machine, and then they're getting frustrated, and then symptoms start to roll in. And so not only are they physically not where they want to be, but then just then all the things that come, the symptoms that come with, they're like, this is the last thing I want. I thought I was doing something good. And I'm like, we need to reevaluate and re-educate what good is, what good diet is, what good health, what good exercise, and what good expectations are. Wonderful. Any parting thoughts?
Not really. That was fun though.
I liked it.
Hmm.
Yeah, we'll do more because I find that this helps just understand the team that we have here, how we can lean on each other, different perspectives. And I also like how like the mind body component kind of came up in each of the cases, because it's always something we have to look at.
Yeah. Agreed.
Awesome. I'm gonna edit
Thank you.
this. Thank you guys, okay? We'll be in touch.
Sounds good.
Bye.
Bye.
Bye.